We've found a frequent need to draw blood from our cows, from pregnancy to mineral and disease testing. Today, we'll show you exactly how we do that, because it's something that if you haven't tried, you might be able to do too.
The supplies are simple: a vacutainer needle with a hub, a blood tube as required by your test, and 2 paper towels, one wet and soapy, one dry. The hubs can be reused, but we don't reuse the needles. Today we're using a 20 gauge 1-inch needle, and to prep this you just twist off the back, and inside is another needle that will puncture the end of the tube. You screw this on, and then when you're ready to draw out the cow, you're just going to pull straight off. Next, we get our cow in a good head stanchion so that they can't move around. Sangria is really tame. I don't worry about getting kicked, but we do put a board here just in case, and we've had to come up with some more inventive ways to draw for the cow that kicks a little more. Now to find that vein, we're gonna just go up with the tail. We don't like this very much, and if you can have someone else hold that there, that'll help you a lot. You can feel there are kind of 2 muscles on either side, and in the middle is a little valley, and that goes all the way up through here. And we're going to draw right in between those 2 muscles. We're going to give it a bit of a scrub with our wet paper towel. We just want to hold that tail nice and straight so that she can't twist side to side. Feel again in the middle there. Have your tube ready, but you don't want to puncture that septum until you're inside. There's a vacuum inside that tube that will help pull the blood in. And then just straight in. Let me just fit this on. Now I don't have anything now, I got just a little bit. I'm gonna move with her, but we're gonna pull back a little tiny bit, just straight back, and then we'll reposition and push up again. If you go too far, you'll just hit bone, and that's okay on a cow. And then pull back a tiny bit and you're gonna be in the vein. It'll fill pretty quickly. Invert your tube, grab your dry paper towel, pull that needle straight out, get it out of your way, then just hold some pressure on that. Last thing, what do you do with your used needle? Just lay your lid down, scoop it up, press it on there. Then you use that cap on there to hold the needle in place while you unscrew it. Screw on the other end and you can throw it away in a normal trash can. To demonstrate how easy this is, Heather's going to try this for her very first time, and we'll get it on camera. And with no experience with needles or anything medical, this should be a good first time. I do strongly recommend that you have another tube or 2 or 3 right nearby, just in case you're not able to get it. If you reposition a little bit, you might start to lose vacuum. If you're pretty sure you're in there and you're not getting anything back, just try a different tube.
Something hard.
I know, pull back, move it to the side a little bit, go straight in.
I think it probably came out and devacuumed. Just guessing. I don't know where to go, Simon.
Right?
Yeah,
Hang on, it's going, it's going. Get the other tube ready. Alright.
Sangria has beautiful horns and we really love them. However, she's really nasty to the other cows with her horns. She's never aggressive towards us, but on the other cows, she uses them to assert herself, and she's left some pretty nasty looking scars. So we are going to try some accessorizing.
You ugly. I'm sorry. No, I'm not. You're mean. Her glare indicates she won't forgive this for a long time. Well, off now to go persecute some other bovines.
She still tries her usual tricks, and the herd scatters, but hopefully this will prevent them from getting gouged if they cannot get out of the way fast enough.
This is Cozy Cow Farm!
We've learned a lot over the last couple years working our mid-century hobby farm.
We've grown, and so has our herd and flock.
But we still try to affordably increase our self-reliance while ensuring we and the kids are having fun.
Every day we find there is still more to learn.
So subscribe to join us on the journey.